Happy Mr. Smith came by to the hospital to get an annual health check. Unfortunately, he was diagnosed with diabetes. Depressed Mr. Smith wonders what has happened to himself. Diabetes mellitus is closely related to insulin. Insulin is a hormone that is excreted by pancreas, which stays behind the stomach and is connected to duodenum. Pancreas consists of islets of Langerhans, and this consists of alpha, beta, and gamma cells. Among them, beta cell produces insulin. The main role of insulin is helping the glucose uptake of the target cell. When you eat, the food goes through the digestive system and is converted into glucose, in another word, blood sugar. Glucose is used as fuel in each part of the body, and in this process, insulin works as a key. When insulin attaches to the receptor of target cell, the receptor sends a signal to glucose transporter to move up to the cell membrane and open the door, which eventually enables the glucose uptake. Insulin also has another major role on storing the leftover glucose. When there is more glucose than needed, insulin also has another major role on storing the leftover glucose. When there is more glucose than needed, insulin moves the glucose from bloodstream to storages such as liver, adipose tissues, and muscle tissues. The status of diabetes mellitus could be drawn in a diagram like this. Number 1, the glucose level in blood is too high. Number 2, it is short of insulin. And number 3, the receptor of the target cell has gone wrong. Number 1 is the consequence of number 2 and 3. Let's start with number 2. Glucose level is regulated by two different hormones, and they are insulin and glucagon. When there is relative or absolute shortage of insulin, that is when diabetes occurs. So what is glucagon? Glucagon stimulates the counter effect of insulin and induces the rise of glucose level. To understand the effect of glucagon, let's go back to the diagram we saw before. Insulin is secreted from the beta cell and glucagon is released from alpha cell. When glucose level rises, a signal is sent by the hypothalamus through parasympathetic nervous system to produce insulin. Insulin then transports the leftover glucose from the bloodstream to storages such as the liver and adipose tissues. In the opposite case, when glucose level falls, hypothalamus sends a signal through a sympathetic nervous system to the alpha cell to discharge glucagon. Glucagon acts in the exactly opposite way of insulin. Glucagon releases the stored glucose from storages to the bloodstream, which ends up increasing the level of blood sugar. Let's see how the two hormones affect in the different parts of the body. First, let's see how insulin affects the liver. The liver will bind leftover glucose and change them into this kind of form to store them. This is how glucose is converted to glycogen and stored for a short term. Next, in adipose tissues, fatty acid and glycerol are synthesized into fat. This way, glucose can be stored for long term. In the muscle tissues, amino acids are converted into protein. This is also another way of storing glucose. Glucagon does exactly the opposite effect in each part. In the muscle tissue, protein will break down into amino acid. In the adipose tissue, the fat is broken down into fatty acid and glycerol. Amino acid and glycerol can be converted to glucose. In the liver, they break down the bindings of glycogen so that they can reverse them back to glucose. Therefore, insulin and glucagon must keep balance to maintain appropriate blood sugar level. This can be shown on a scale. If the glucagon is relatively less than insulin, glucose will be kept inside which will end up by lowering the blood sugar level. However, if insulin is relatively less than glucagon, the glucose will be released from body parts back to the blood, resulting in increased level of blood sugar. Now let's see how number 3 ends up with number 1. Insulin works as a key in glucose absorption process. When insulin meets the receptor of target cell, it sends a signal to glucose transporter to move up to the cell membrane and open the door to induce glucose intake. However, when receptors become insulin resistant, insulin then cannot affect the receptor to send messages to the glucose transporter. So, even though there are enough keys to open the door is no more available. So glucose ends up floating outside of the cells, resulting in rise of glucose level. So to sum up, number 2 and number 3 are different causes of number 1. Based on the two different causes, diabetes can be distinguished into two types. Type 1 diabetes is due to number 2. When the beta cell is damaged by hereditary or environmental factor, it cannot produce enough insulin. In case of type 2 diabetes, which is due to number 3, even though the beta cell releases enough insulin, the receptor malfunctions. 10% of all diabetes patients suffer from type 1 diabetes, and the other 90% suffers from type 2 diabetes. This is a picture of a typical patient for each type of diabetes. Type 1 diabetes patient looks like a slim young man. Type 2 diabetes patient looks a lot more old and chubby. Let's see how type 1 diabetes and type 2 diabetes are different from each other. Type 1 is caused by heredity and autoimmune disease, when type 2 is related more to family history or obesity. The most important difference is that in type 1, the insulin production is out of work while the receptor stays normal. However, in type 2, insulin production is on the work while the receptor goes through deformation. Symptoms are closely related to the existence of insulin. Type 1 with minimal amount of insulin tends to show quick symptoms, while type 2 with normal amount of insulin tends to have gradual symptoms. Treatment focuses on the cause of each type. Lastly, ketoacidosis is the most severe complication of diabetes. We will cover this part later on, but just for now, acknowledge that it also correlates with production of insulin.